Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am joined by Sandra Bodenhamer, the director at Rise Community Health Center, and Nilam Khoja, the manager at Rise Community Health Center. Rise is located in Vancouver BC and is a grant recipient for our Systems Navigation Access and Partnership Project, also known as the SNAP project. Through the SNAP project, CHCs are increasing efforts to improve health and social systems navigation access to strengthen Canada's healthcare landscape and eliminate health disparities while improving population and health outcomes. How are you both doing today?
Good, thanks.
You're doing good?
Good. Glad to hear you're both doing well over on the West Coast. Sandra, I'll start with you. Can you tell us a little bit about Rise Community Health Center, the community that you serve, and some of the programs that you offer?
Sure. Rise Community Health Center is a fairly new community health center. We started running some services in 2019 and officially opened our center in June 2020, right in the middle of COVID. We're actually a part of a neighborhood house, Collingwood Neighborhood House, in the Renfrew Collingwood neighborhood of East Vancouver. And in this neighborhood, there had been some primary care centers that had closed over time, some CHCs that had closed, and there was a real gap in attachment for people seeking primary care, and particularly those that had barriers to accessing care. So there was a community needs assessment that Collingwood Neighborhood House did over 2018, 2019, and developed a proposal. And we're part of a new sort of funding initiative for CHCs in BC. We were one of the first new CHCs. So we've been growing from 0 to about 2,000 patients till today, and from a staff of 1 to like over 40 today. So Rise Community Health Center, our main focus is a interdisciplinary primary care clinic, but we also provide harm reduction supplies, naloxone training, and all our providers are trained in providing opiate agonist therapy. And we also have recently opened a nonprofit pharmacy dispensary. So that is a new project for us and something that we hope over time can help contribute revenue back into the sustainability, and also to help provide patients with subsidies for prescriptions. We're also part of a larger organization, Collingwood Neighborhood House, and they provide many of the social determinants of health services that often CHCs struggle to fund by grant. So it is really a unique and useful partnership to be part of a neighborhood house. They provide family and early years programming, childcare, food security programs, homeless outreach, newcomer programs, settlement services, recreation services, senior services, youth services, and community development.
Amazing. Nilam, I'm curious. So as we've mentioned in the intro, Rise was able to receive funding from our SNAP project, which is well underway. Can you tell us a little bit about what your SNAP project is, what you were able to achieve so far, and some of the impact that the project is having over in BC?
Sure. First of all, thank you so much for providing us this opportunity to talk about this SNAP project. And since we received this funding, we made like a huge changes. We implemented a Cortico plugin system that is attached to what we are using right now. We are using an Oscar electronic medical record system, so it's like integrated with that. So one of our the big achievement is providing more accessibility of booking appointments. So Cortico basically allows our client to book appointment anywhere, anytime. So it's freeing up more time for our staff as well as for the front desk. So clients can book appointment, because you know that how diverse needs of our communities are, right? People are working quite late, so they can book their appointments without having any problem. They don't need to call the front desk, so they can just book anytime, right? Beside that, we are also now able to provide virtual care options to our clients who are having some transportation limitations and are facing anxiety barriers. So this is like a very good outcome for those of our clients. We also did like with this system, we also are like providing, 3 appointment reminders. So like 2 appointment reminders as an email, and 1 appointment reminder is like a 90 minutes before their appointment. So it's also like through that implementation, we find out like the no-shows are like like the arrow is going down. So people now can remember their appointments, and there are like significantly, like we can see it, like there is a reduce in no-show rates.
That's amazing. That sounds absolutely wonderful. And I'm curious if there's any other this wasn't a scripted question, but any other positives that you're adding, because I can imagine as someone who works from home and several jobs, they have experienced that as well, finding it difficult to just book an appointment for minor things, especially how COVID has changed so much of the systems. Are there any other positive outcomes that have come from this, or any other testimonial you can share that has impacted your clients?
So it's impacted to our clients a lot, but as well as with our front desk staff too, because I remember like before COVID or in COVID, we were actually manually texting our clients for appointment reminders, like each client. So for example, we have like a huge team, as Sandra told you, like we have 40 staff working. So for all 40 staff, there are like at least 5 or 10 clients for each day, right? So we have tons of like clients to be seen. So it's like a day before we send out like a manual reminder to them. So it's make a huge change. So now that same staff doesn't require to send the manual appointment reminders, and now those reminders are actually going out through this plugin system automatically. And then clients are also now able to reschedule their appointments, so they don't need to call us. So this feature allows them to reschedule their appointments too. They can even cancel their appointment, and once they cancel their appointment, they're able to rebook another appointment with their providers.
That's amazing. Go ahead,
Just
Sandra.
to add to that, just to add to that too, I think so in freeing up the time for the front desk staff, as you can imagine, like they were constantly receiving phone calls, constantly calling to remind or texting to remind. It was like a split of time and attention between people who are actually face-to-face in the clinic and people who needed those phone calls and reminders. So I think it's freed up more time for the MOAs to be able to do the face-to-face work, and also to carry out the assigned work that they have to do as part of their MOA job. So it really shifted their workload to be able to provide better care and more face-to-face time with clients, rather than people getting jammed up on phone lines. I would say like a common complaint before was I couldn't reach you on the phone. I couldn't get through on the phone. So that has reduced now.
Amazing. Quick question, if you wouldn't mind elaborating, what is an MOA?
It's a medical office assistant, so our front desk staff. Yeah.
Amazing. Perfect. Just in case anyone isn't in healthcare who wanted to know what that is. Sandra, and I'll continue with you. So through implementing this tool, have you experienced any challenges while trying to implement it? And if so, how were they addressed?
So there's a lot of back end work in terms of the setup, and I'll ask Nilam to talk a little bit more about that, because she's been the person doing the back end setup to try to get Cortico to work with our system and the way we've been using it. And also, of course, teaching the staff and kind of teaching the clients, piloting it, seeing what's working or not. For example, clinicians have to put a certain setting when they're booking an appointment. Sometimes they book appointments, they book time just for themselves to work on paperwork associated with the client. If they didn't change a setting, that might send an automatic reminder to a client saying you have an appointment with your doctor at this time. So that was just like some little learnings about the settings and how you had to install it on your computer, and kind of learning through errors, sometimes patients showing up, but they were very generous to understand. And we let them all know, like, we're trying a new system. Please give us a little bit of grace period. And another thing, it's just a lot of technical issues. So for example, we have a workflow where we work as a big team. So usually if a client calls, it's first received by a nurse who triages, who understands the need and sees who they need to have an appointment with. Can it be just addressed on the phone with the nurse? Do they need an appointment with the nurse practitioner or doctor? Is actually a social worker that they need to do that? So if people are then booking on their own, we had to understand, how does that affect triage or not? What types of appointments can people book on their own? That doesn't need to go through our triage system. So yeah, so it's not just as straightforward as you're always booking with your doctor. Similarly, we have some internal referrals. So we have some staff, I would say counselors, physiotherapists, social workers, dietitian, and those services are reserved for clients that don't have extended benefits, because we do provide free services, right? And we have a limited amount of providers. So we can't provide everyone with free physiotherapy, but if they don't have coverage, then we prioritize those clients. So we have to figure out, how does the system recognize that who is able to book with different providers. So I would say like quite a bit of technical back-end setup, and we're lucky that Nilam is a tech savvy person, because I think, maybe not everyone in a clinic would have a tech savvy person that would be able to do that kind of work. I'll let you talk though more, Nilam, because you're
Sure.
more involved in that back-end setup.
Yep, I'm happy to discuss this.
Yeah.
Okay, so indeed, yeah, for sure. Whenever there is like things are coming up in part of like integration, it's always like it's always been seen that there are challenges, and that is true that we also face some challenges. But however, through some proactive measures, we took initiatives, and then we navigated those obstacles, and making this integrations like smooth for even for clients and for staff as well. As we send out like a mass email to all of our clients with like how with some videos and like some resources they can see, and how they can use those online features. Same for the staff, like whenever there is a new integration and then unfamiliar tools, right? People are like a little hesitant to use it. So what we did is like we run some like training sessions in our staff meeting and huddles, and try to provide like on board like every day, like I'm here around, and then if you need any help. So yeah, so like at the first point, staff were like a little hesitant, and then now they are feeling that this is quite useful and valuable asset in their like daily workflow. Beside that, we also having some, like as Sandra mentioned, that there was always a technical problem. So while staff are working remotely, they were having troubles in accessing our like video, like the camera and microphones through this feature. So that we something work with our IT person, and as well as with the Corico team, to figure out like how we can use this tool while staff is working from home through the remote desktop server. And now I'm happy to say that we are able to use our video feature through our remote servers. So yeah.
That's wonderful. Thank you. And just out of curiosity, I mean, it sounds to me like this is going to be sustained, but does that RISE have plans to continue to be using this navigation tool for long term?
Yeah, I can answer that. Yeah, yes, we do. We have found it useful. Part of the grant was in the wrap up is to kind of do a bit of a cost benefit analysis and see, do we need to have Cortical for all staff? Are there some staff that are not using it, or some staff disciplines that are not using it? Would we benefit from the standard package or the premium package? And how much do we use it, to see sort of at what level we need to continue sustaining it? But one of the reasons we went with this was because we noticed like a huge workload for our medical office assistants. And in our model, medical office assistants and managers actually are not funded as staff people. They're part of what's considered like an overhead to run the clinic. And the overhead is limited due to, for example, the cost of the lease in Vancouver. You can imagine, to rent clinic space. It's a huge cost, right? So it is actually difficult for us in our funding model to increase hiring MOAs. So what we could do was use this to kind of reduce the burden for them. Yeah, so that's what we're hoping to continue to sustain after this project.
Amazing. And actually that is a perfect segue into my next question and second last one. What would increased federal or provincial investment as a whole allow for Rise Community Health Center to achieve long-term? Within the SNAP project, outside of the SNAP project, in any capacity? Sandra, if you'd like to go ahead.
I think just recognition that, there's a lot of pressure in BC to attach more clients to primary care. There's a shortage, and it's a big focus in the province. And there's a big focus on, hiring doctors and nurse practitioners. But the recognition that it takes more than a doctor or nurse practitioner to do the whole process of bringing clients in, making appointments, managing it. It's a whole team effort. So although, yes, it's great and we need more doctors and nurse practitioners, I think investment in the rest of the team is equally important. And I think more so use of technology in this day and age, to help clinics convert to even going from paper charts to online is a big deal. And if there was some way that clinics, or especially CHCs, could be funded to have electronic medical record system, perhaps even we could have the same electronic medical record system and some kind of discount pricing on that. And so that we don't all have to do this individual technical setup, which we are not funded for, which is why we needed the grant, right? So if we can use the tools that are available to us that can help focus the work towards working with the patients, we can do more patient-facing work if we didn't have to do as much sort of, I'm not going to say paperwork because it's online, but it's all that setup that's involved. And if you want to have a well-functioning clinic, if you want to be able to provide statistics and provide reports and do all these things that we're being asked to do to prove our work, like there is quite a bit of teamwork involved, and there's quite a bit of technical tools that could be helpful. So just, I think, a recognition of that as well.
Absolutely, helping with that digital equity and making sure that we're all sort of up to date and on the same page. I completely understand, and it's not something I have not heard from other CHCs. Sandra and Nilam, I want to thank you both so much for taking the time to speak with us today. I'm so happy that CACHC was able to share the SNAP project with your community health center. Before we go, I do want to ask if anybody listening was interested in learning more about Rise Community Health Center, where would they go to find out more?
We do have a website, so it's part of the Collingwood Neighborhood House website. So the link is www.cnh, as in Collingwood Neighborhood House, .bc.ca/rise.
Amazing, wonderful. Thank you both so much for taking the time to speak with us today.
Thank you.